Good morning, everyone. Welcome to the second day of the third ELETS Healthcare Transformation Summit. We've had a great start to this summit with rounds of discussions around various facets of technology driving futuristic healthcare on day one. As we move ahead, it is my proud privilege to have such a galaxy of esteemed speakers joining us for a discussion on the future of healthcare, value creation through next generation business models. Joining us today for the discussion, we have Dr. K. Hari Prasad, President, Hospital Division, Apollo Enterprise Limited. Welcome, sir. Mr. Vinod Sawant-Wadkar, CEO, Jahangir Hospital. Welcome, sir.
Thank you.
Dr. Biren Chauhan, Chief Operating Officer, Sunshine Hospital. Welcome, sir.
Thank you.
And Dr. Jyoti Yadav, Director, Kamala Hospital. Welcome, ma'am. So I extend a warm welcome to everyone. And to begin this discussion, so we have a series of questions, and I'll be opening all the questions to all the panelists so that we have comprehensive insights from everyone. So to begin with, my first question is for Dr. K. Hari Prasad. I'll begin with you. So what were the initiatives that enabled you to drive your vision and mission forward during the pandemic?
Well, if somebody asks you what is the reason for your success, most of us would say right decisions. And how do you make the right decisions? It is with experience. And how do you gain experience? By making the wrong decisions. Healthcare systems across the world have made multiple wrong decisions. And that is probably one of the reasons why we landed up in a mess during the pandemic, especially during the second wave, and even in the third wave in some of the countries. I just read an article today where in Hong Kong, people are actually putting up tents outside in freezing temperature and putting patients under the tents. So the entire, even the more mature, and what we say is maturity evolves from understanding the immaturity. We thought many of the countries, developed countries, have a mature healthcare system, but the pandemic proved it wrong, and it showed us how immature our healthcare systems are. And it is a true opportunity to create a mature healthcare system. The pandemic has given us the experience and the maturity to develop a good healthcare system. When we were all frustrated, and we continue to be frustrated because of the pandemic, when there is frustration without action, failure is the end result. But when frustration is coupled with action, success follows. So frustration is actually a good thing, provided we couple it with action. So I think the pandemic has provided us with an opportunity to make big changes in the healthcare system, and changes which are not just adequate to address the current problems, but also to think into the future, to look into the future, and make these changes appropriate for the future. And we've seen that a lot of things have changed. And one of the most important things which the pandemic has thrown up is to be able to be accessible to the people in need. And our mission, Apollo's mission statement says to bring healthcare of world-class standards within the access of everyone. And to achieve that mission, we embarked on a digital pathway, because there were lockdowns, people wouldn't come out, people were scared of hospitals, and a lot of multiple things happened. So the geographical access we could address by providing multiple options like the telemedicine, e-ICU, e-emergency, telepathology, teleradiology, teleophthalmology, and telemonitoring, and telementoring. Now, all these things have made a big difference during the pandemic. And I genuinely believe that these are here for the future, and this will increase the access for people in the future and make geography history. India is a huge country, and making geography history would be a very, very relevant solution to the challenge healthcare faces. The next thing is making it accessible also means financially accessible. There is a significant section of our population which cannot afford the advanced healthcare in a good hospital. So I think creating financial resources to be able to access the good healthcare system is the next thing, and the only solution to it is insurance. And I really hope that uh, the social insurance schemes are growing big, but I guess that is not the solution. Mandatory health insurance is the solution, and I think when you can't have a vehicle on the road without insurance, I think human beings are that much more precious than a vehicle. So I think
Right.
making health insurance more mandatory for everybody is absolutely necessary. And the last thing which I would say before and end before as an answer for this question is, I think one of the things which we've learned during this pandemic is we don't need to depend on imports for a majority of our requirements in terms of healthcare. We were heavily dependent. A large hospital doing tertiary care and quaternary care would import as much as 60 to 70% of its consumables and equipment from abroad before the pandemic, including the simple PPE. Now we've seen during the last 3 years of how much the Indian industry could do. The pharma was always good, the vaccines, the immunological industry was always good. But I think the medical manufacturing industry really threw its weight behind the healthcare sector. And I think being self-reliant is the next thing that we have learned and realized during the pandemic. And I think that is another thing which we would nurture to really make India a global healthcare destination.
Right, right. Thank you so much, sir. If may, I may ask Mr. Vinod Savantwadkar to respond to this question. Sir, you're on mute. If you could unmute yourself. Yeah. Yeah.
Yes,
So,
a very good morning to everyone. People who don't know, Jahangir is a charitable hospital, and we were among the few hospitals to get converted as a COVID care center quite initially. And everyone knows that Pune has seen a huge rise of cases all throughout all the three surges. The initiative which kept us going throughout the pandemics, if I need to point it out, then it would be in three areas: our people, the operational preparedness, and of course the utilization of the technology. So when it came to a people, we kept the team welfare and their safety as our utmost priority for us. There was no compromise in those aspects. Of course, in the first wave, it was a newness of the virus. It was newness of the disease which we were trying to understand. So we had to, draft the protocols, and more than that, train our people. Have a proper walkthrough among everyone, make them understand what is it and how it is different than what we were attending before. We also had to create a very, very comprehensive team of the people, which included people from administration, medical side, the clinicians, including ID specialists, intensivists, physicians, right from security to IT professional. There was a very comprehensive team which we created, and we could meet very often, in fact every day, in terms of understanding what are the gaps and trying to bridge those gaps. And to support this, we also came up with some of the fringe benefits, because it was the first time wherein you could see your staff standing for a long hours with the PPE, and that was something which was very, very difficult. They didn't even have a time to go and eat their food. So the team and the people management has been extremely important in all this while. So that's one thing. Second thing is, definitely, as I said, it was a newness of the disease, a newness of the virus which we were trying to attend initially. But the operational preparedness was extremely important. We prepared ourselves in terms of segregating COVID and non-COVID. Now when we hear it's look little easy, but imagine in March 2020 and April 2020, it was way different scenario. So we had
absolutely.
to keep this. We have to segregate IPOP again in COVID, non-COVID, essential services, like you have emergency, you had OT, you had cath lab, labor rooms. So we went through all that. Supply chain was something which was we had to tighten right at the beginning, because we knew we could come to a shortage at any point of time. Not only the medicine and consumables, but the other essentials like even F&B and the other things. So we had to work on that. So that another second area which we had to work. Third was, the utilization of the technology. Believe me, the acceptance levels among the staff and among the people, what we have seen in last 2 years, is much higher than what we were trying to advocate and what we were trying to do in last 7 to 8 years. Not that this technology was not available before. A lot of things were available pre-COVID era, but there was a great amount of acceptance and small steps which we took. Like the telemedicine, we reinforced in home healthcare. Telemedicine had a great support. The teleradiology had a great support here. Small thing like you updating your ipbx and a call center system which can take more calls, because everyone wanted to reach out to the hospital and check what's happening, whether beds are available. So these were the few initiatives which we took, and it actually helped us to sail through the pandemic, though it is though the cases are still there, but not what it used to be 2 years back. So these were the three areas which kept us going throughout the pandemic. Yeah, thank you.
I think we lost the moderator. We could do the moderation ourselves. I think we'll request Dr. Biren Chauhan to answer the question.
Yeah. Good morning, everyone. And see, almost 2 years into pandemic, and it is a long time horizon. And I think the only positive change has happened is that healthcare has become a central theme around which everything revolves. Be it a politics, be it geopolitical issues of the technology and the digital adoption and all. With reference to Sunshine Global Hospitals in Gujarat, as a multi-speciality hospital chain, our vision is to be the leading hospital for trusted care. And throughout these 3 cycles of COVID pandemic, what we did from the start, that rather than being restrictive in nature to the relatives of the COVID patients, we actually become the facilitators, and with proper infection control practices and PPE kits, we allowed relatives to be around their patients once in a day, twice in a day, and now we allow relatives very freely, just like the non-COVID, with all the precautions and all. So that was the one thing that we acted since the first cycle, because we were very sure that it is not only the patient who needs to be cared, but it is the family and the ecosystem which needs to be taken care. And with these practices, even if in my today's occupancy, more than 25 to 30% patients are those patients who were treated by us during the COVID pandemic. So now they are the loyal customer base we could generate out of this COVID pandemic. Another thing that we did very successfully was to liaison with the local regulatory bodies, be it the collectorate office or the health department, and be very vocal and proactive in giving the ground level realities and helping the Surat and Vadodara to tackle the COVID pandemic in a better manner. Right? We were early adopters of the oxygen generator plants since 2015-16, which provided a lot of insight to the other players in these cities, and ultimately everyone adopted the oxygen generation plants and all. Another thing that we did was to be the facilitators for the the community, and we provided them a lot of educations. A lot of medical professionals of the government hospitals were trained in our ICUs and our wards to tackle the COVID pandemic very well in the nearby peripheries and all. So that all really made a lot of difference, because COVID was not fought at the bedside, but it was fought at the every family, every home, or every individual. Right? At the same time, supporting the workforce through giving them the group medical insurance, taking care of their family members. Even I remember during the first cycle, we were sending our vehicles to the employees' homes and their families' homes to support them for the grocery and the vegetables and the milks and the other products. Right, so that made a lot of difference, because the turnover was very high because of the fear, and then the lack of uncertainty and risk to the employee workforce. But that kind of a kind gesture from the the hospital side protected the entire workforce, and they all bound on a very larger vision and mission level. So that helped our hospital during the pandemic.
My apologies. I experienced power failure, so I had to log off. I'm really sorry for this.
That's fine.
So I think Dr. Chauhan has already shared his, or are you, sir, continuing with your views? Right. Okay. Dr. Yadav, if you could. Okay, sir. Sorry. Yeah. Dr. Yadav, if you could respond to this question about the initiatives that you took
Yeah.
during the pandemic. Yeah.
Yeah, thank you so much, first of all, for inviting me. I'm the director of Kamla Hospital, which is almost a 100-bedded setup now. And it is a nursing home practice, I would say. We all belong from different categories of hospitals, starting from Apollo and the chain of hospitals. But this is a single hospital which was like landed up being a COVID hospital by the government, forcefully or unforcefully, I would say. We didn't have any escape of it. It came almost all of a sudden, I would say, as an opportunity in disguise, or you can say it as a blessings for the healthcare. Because after this COVID or into this COVID, we prepared our staff first of all, because we need to have the force to fight with the like COVID situation. And the first thing we need to prepare are the hospital staff. That was the biggest challenge. First of all, I had to call each and every individual staff to work in COVID. To convince them for COVID was a challenge for the hospital management. There were a number of staffs who left in between. There were the staff who fell into COVID. We need to provide them the healthcare system for our staff, first of all, make them assured if anything goes wrong, we are there to help. So we provided them with the healthcare policies, insurance policies, assurance for the family even. Then we made a team to work in COVID. For nursing home, I would say this was the biggest challenge, because for big setups, we have all other paramedical staff as well as the digital team. These things, they came little late to us, but definitely we use the digital platform for healthcare in order to consult the families, in order to have the video callings, in order to have the teleconsultation. Me being a gynecologist, it became little difficult for me, the patients who were like antenatally with me. And all of a sudden the COVID came up. There were a number of ultrasounds which were missed by the patients, and after that there were like again question marks on the gynecologist, why this level 2 was not done, why this level 1 was not done, why the markers were not done. But we were in a mess situation, and yes, we missed a number of things regarding the care of the patient. But whatever we could do, we did that, I suppose. And everybody did their best in the healthcare. But yes, there were problems, even because the thing, my hospital was on Ayushman Bharat panel, and that was the biggest challenge, I would say. People with the Ayushman card, they were like after my life to get admissions, and we were not getting the resources. That was another problem, because everything, the PPE kit became short, the gloves became short, staff was like misusing, or I would say overusing the stuff. Every 2 hourly they were changing the PPE kit, in spite of teaching them how to wear it, how to take it off. Every day we used to teach them in order to save the resources, in order to conserve the resources and give the best care to the patient. And when it came to the policy holders, like insurance companies also made a capping on the resources, but we were getting in twice the rates, triple the rates, whatever amount they were asking, we were getting the things in cash. No debits, no credits, nothing. Hardcore cash we were giving for taking up the PPE kits at n number of prices, whatever they are quoting. My physician in my hospital, the pulmonologist who was taking care, is 7 feet. I was not even to cater the PPE kit for him. So it became a biggest challenge for me at that moment of time. So we need to tailor the PPE kits for the staff, and as well as to teach the sweepers. The housekeeping staff was the almost, I think it was the biggest challenge, because doctors were very well aware. Nursing staff, again, it was okay, but there was the wastage of the resources at the housekeeping staff as well as the attendance of the patient. I would say this digital time which has come up for the nursing homes, even we are now okay. I am doing all teleconsultation, I was doing counseling, I was giving being a gynecologist, I became more of a physician at that moment of time, I would say, in the whole pandemic zone. And the second wave, yes, definitely we were in out of stock for the oxygen, and there was a biggest fight for the oxygen which came up for everybody, I would say. But here the officials in Gurgaon, they were very well coordinated, and the system was designed in such a way that we were allotted particular centers for oxygen. So there was less of panic, but because there it was a shortage throughout the country, so definitely we had to bear that burden of even a shortage of oxygen. Then we came up with oxygen generation plant after that, a second wave, and now we are with oxygen generation plant for the third wave. I think everybody is well aware of the things, and now the things have become so normal. We allow attendants also to meet the patients. We allow even the COVID and the non-COVID zone in the first, when it came up in the first wave, separating the nursing home into two zones was a tough task. To make different entry, to make different exit, we need to we put the partitions and so much of the work. Even the plumber, everybody who was like, there is a switch which is not operational and the electrician is not ready to go inside. It was so much of the fear for everybody in that COVID. But now I think we are well versed, well prepared, although with different strategies. Every fortnight the strategies were changing. We need to be academically updated, we need to be practically updated. And in nursing home, the biggest challenge, we were working with small staff and on the toes, in fingers crossed that nobody fell sick or nobody get entrapped in COVID, because the whole ecosystem got disturbed because of it. So I hope in my hospital we worked very well and came out of all the three waves, and we are still having the COVID patients with us.
Right. So, it has been a transformative experience for everybody in the healthcare sector. So, Dr. Prasad, if I may begin with you on the next question, so do you see something, as a concept of, preparing a hospital that is pandemic proof? So, do you see any steps that hospitals can take to, create that ecosystem?
See, if you take the experience of COVID, I think the only thing which was consistent was the unknownness of the virus. You wouldn't know what it does. So to make something and say that this is pandemic proof would not be an appropriate thing to say. But all we could do is peep a little bit into the future and prepare our healthcare system to suit the requirements of the future. In the future, I think transformational changes have started happening, and these are going to continue into the future. Today, we talk about a group having 10,000 beds, 5,000 beds, or a hospital having 100 beds, 50 beds. I think as we go into the future, beds are going to become irrelevant. It's not going to be about the number of beds. And I always say the future of medicine or healthcare is, I've repeated this on many occasions and I'll repeat it once again, is in the 6 P's. The first P is preventive healthcare. Preventive healthcare is going to come into the forefront simply because people now understand that diseases are preventable. Imagine people being locked up in houses for 3 months, 4 months for the fear of the virus to prevent a COVID infection. So and the future is all going to be about non-communicable diseases, which are all preventable diseases. Whether you take your hypertension, your coronary artery disease, your obesity, your cancers, a lot of these are lifestyle related, and modification of lifestyle can always have a positive impact on this disease profile. The next thing which is going to happen is proactive. Now, I remember we used to see cancers in the most advanced stage only. But now there is going to be a lot more proactiveness in terms of the community, in terms of the medical fraternity, and probably we'll see and diagnose diseases much earlier than what we used to do in the past. This will also reduce morbidity, reduce mortality, and more importantly, reduce the cost of care. Because, for example, in oncology itself, treating a patient in stage 1 cancer would be that much lower cost compared to treating a patient in stage 4 cancer. So I think a lot of proactive medicine is going to come into this thing. The third P is predictive healthcare. With all the artificial intelligence, with all the molecular genetics and all that is coming in, it is possible to predict the course of the health of an individual. Now, by doing the genetic sequencing, people are now able to tell which individual is likely to get which form of disease, whether it's diabetes, hypertension, or a particular type of cancer. So there's a lot going to be happening on the predictive front as the science grows. The next one is precision medicine. Now, a lot of things which were not really precise, which were taken as they came, are now going to turn to precision medicine. And one great example I can give you is radiation. We had the cobalt machines in the past, which used to burn a lot of normal tissue around the tumor. Then we came in with linear accelerators, which burned less of the normal tissue around the tumor. But now we have the proton therapy, which burns only the tumor and no normal tissue. So that's going to become more precise. Similarly, robotics may come into the picture, where again precision medicine is at its peak. So what this precision medicine does is it improves morbidity, reduces morbidity, and also reduces the need for length of stay in the hospitals. So that is why I said number of beds in a hospital is going to become less relevant. The next piece is about partnerships. Now, a lot of us believe that we are great within our own sphere. In my hospital, I am confident or independent of doing things. My group, I am independent of doing things. But I think the future, we cannot continue that way. We would need to work in partnership with all the stakeholders. Now, who are the stakeholders? It is a community, it is healthcare providers, it is the people who provide to the healthcare providers like the pharma industry, the medical manufacturing industry, and finally the state and union governments. So all these people will have to work in partnership to be able to deliver care for the people for the future. The next one is, and the last P is the policy. Now, during the pandemic, we saw the policy was changing every day, and each state had its own policy. Now, I have hospitals across the country. So it was really madness to understand the policy of each state, and which kept changing by the day. So there needs to be consistency and clarity in the policy of the government, both at the central level and at the state level, because health falls into the concurrent list. And we need to make sure that the policies are friendly to all the stakeholders, particularly the community, the patients, and the healthcare providers. So I think looking into this 6 P's is very important while we create the healthcare infrastructure of the future. And we also see, the reason why I said beds will become immaterial or history is newer models of care are being evolved. Home healthcare has become a big thing during the pandemic, and it is here to stay. Wearable devices have become a big thing during the pandemic, and they're only going to grow. You don't need to go to a hospital even to get your vitals or some of the advanced investigations done. They can be monitored from home or wherever you are with a wearable device. So a lot of new models of healthcare are being evolved, and all this needs to be factored in while you're planning the future. And I think this is more relevant than actually working towards a pandemic-proof hospitals, because the nature of a pandemic is the uncertainty, and you cannot plan for uncertainty.
Absolutely right, sir. Thank you. Thank you so much for these pertinent points, sir. Dr. Biren Chauhan, if you could, throw insights on this topic.
Yeah. So Dr. Hari Prasad has covered a lot of good aspects around it. I think the future-proofing the hospitals and the healthcare ecosystem from the pandemic point of view. I think intervention has to be at 3 levels, from the patients and the families' point of view. Before the patient gets admitted, so it is like pre-hospitalization level, where the role of government and the government bodies becomes very, very important. They have to assimilate in the community. The information has to reach to the right information has to reach to the community, and the public behavior towards health and the healthier practices should change, and that can happen through the wider level engagement towards the community by government and the government bodies. Right. Another thing that government has to do is, the lot of research and development. In the first pandemic, we were, importing a lot of things, and then the Atmanirbhar Bharat concept really got materialized in the healthcare sector through the advent of COVID pandemic, right? So that role is very important before the patient gets admitted, right? So the ecosystem has to be created at population level by the government and the local bodies, where private hospitals and the private players do have a larger role to, engage with the community at right point of time. Once the patient gets admitted, that is during the hospitalization, the hospitals has to understand, and they have to be a little bit flexible, right? A lot of people found it very difficult to create a COVID and non-COVID zones, right? So that flexibility has to be there in the hospital infrastructure with reference to manpower, quickly scaling up the manpower and the resources and retaining them, right? clinical research and clinical development and the clinical practices in India, if we compare in the COVID pandemic against the Western world, we can say that we have delivered a good outcomes at a reasonable cost as compared to the Western worlds, right? In the COVID pandemic. So thanks to the medical fraternity or the clinical fraternity of India that we have been able to achieve at this scale. Even the vaccine were initially developed in with the India's participation at global level. So that are these are the things that during the hospitalization. One more aspect is about the digital adoption by the hospitals and the healthcare providers, so that they can connect and care for the patients well advanced in time. So that is also very, very important. And the most important part, I believe, that where we have a lot of work to do is the post hospitalization or post discharge, right? Once we treat the patient, we send them home. How do we connect and how do we ensure the connectivity with the patients, right? Whenever they have some queries, how can they come back to us, right? So digital health and the home healthcare concept is now will be the very central and pivotal point. No hospital can left the patient on their own after the discharge, or cannot wait till the patient comes to their OPD for the follow-up, right? We have to reach through the digital medium to the patients and their families. So home healthcare is going to be the next big phase along with the digital adoptions, right? And if we see the budget announcements, mental health support, because of the adverse effects of the COVID pandemic, not on the human body, but at the mind level, mental health care level, is also going to be very, very critical and crucial, right? A lot of, we have to understand from the patient's point of view, insurance company didn't pay the full amount to the patient when they got when they spend for the COVID treatment. And socio-ecological stature is also changing, and the patients are suffering from the mental health point of view. So hospitals and hospital providers do have a role to support the patients and their families to the best extent possible. So I think these are the three levels and three intervention levels where all the stakeholders can come together and can have a very positive impact, so that we can be future proof with reference to the pandemics.
Right, right. Thank you. Thank you, Dr. Chauhan. Very insightful. Mr. Vinod, if you could, throw some light on these issues.
Yes, I will. I'm very sorry because I lost when you are moderating the second question. So if you could just repeat, and they all look quite
Yeah.
similar. So
Sure, sure. So, I just wanted to understand, the measures that can be taken to build hospitals that are pandemic proof, so what are the opportunities there that can be, kept in mind?
well, the fear of returning to where we were before is huge, and it looks like it will be a snowball, and it will become something very big. It's very, very scary, so infectious disease are increasing mainly because of the various reasons, and they are going to come more in future. It looks like that because of the climate change, because of you are looking at zoonotic diseases. So it is going to come, and more than before now, it is very important if we are looking at to start new hospitals. How do we create these hospitals which can which can allow, or which can help if we have such kind of incidents, how it can work very smoothly. So the areas, and like working in pandemic could be very stressful for your staff, for families, for patients, for everyone. So we need to consider all these aspects when we are looking up, when we are trying to build new hospitals. Like the hospitals need to be very, very versatile. We spoke when we have been talking about this, and it should not be very rigid in terms of the flow. It should not be very rigid in terms of the way how we are building traditionally. Hospitals also need to be ready for a surge, because we have seen things can just change overnight, and then we all trying to run everywhere in making the resources available. So the hospital need to be need to build from a point of view of wherein they are ready for a surge. Yes, the well-being of the staff, for the patients, the hospitals also need to support. We saw initially there was a lot of panic among people, including staff and patient. People were not able to see each other, and that create a further panic. So well-being is something which need to be seen, like a clear airflow, space. These are the small things. Surfaces need to be taken into consideration, like having we always went into having a centralized AC, and we know what happens with that. So these things also need to be taken into consideration. We are talking about the technology. So technology should amalgamate with the physical structure, because we know pandemics are not very often, but it should blend in a nice way. So these are the various areas which actually need to be thought of, when we are looking at the future hospital setups. But what happened to the the hospital setups which are already there? A small changes like having every bed having oxygen and suction port, having a proper flow in the hospital, so whenever you want you can segregate. These are the areas which can be looked after by the healthcare professionals who are heading the hospitals, and this could actually help us in preparing very uncertain outbreak if at all it comes in future. Of course technology is going to play a very very vital role in making things more accessible, no doubt about it. But structurally I think so these elements need to be considered when we are looking at how to make hospital who are more compatible in facing the pandemics, rather than saying it how to make them pandemic proof. I mean that's something which is very big question to be answered.
Right, right, right. Thank you, sir. So, Dr. Yadav, if I may have your views on this.
I think most of the things has been already covered, but still I would say okay, we need to have a teamwork. May it be a doctor with a staff, that is one team. May it be the patient and the doctor, and third is the government agencies. When these three people, they three groups, they work together as a team, I think the healthcare system will improve over the time. The policies which are made by the government there has to be a proper education and communication to the community. That's the biggest problem. The policies is made like Ayushman Bharat, as I told in my first question also, it is not properly communicated to the people. They don't know what exactly it is covering, what exactly it is not covering. They are on our head with that policy card, and in order to have that, they have the 5 lakh cover, and doctor do everything. So there has to be a proper education to the public. There has to be a proper education to the staff. There has to be a proper updation of the doctors. Even in the government setup, there were a number of ventilators which were lying altogether useless because the doctors were not able to operate on them. They were not well trained. They were not given any kind of training for the updation of the machines which are coming up. We imported so many of ventilators, but we didn't have the people to work on. So there has to be proper education and upgradation of the skills of even doctors by the government, I would say, because government agencies, although they cater a huge number, and they were inviting even the private practitioners to support the government agencies. So there has to be to and fro support by the government as well as the private practitioners. So both the things can work together only with the updation of the skills, proper counseling and communication, I would say. We face problems when we don't communicate with our patients. This I have learned over a year of almost 15 years now. When there is a lack of communication, there arises the problems. The patient, when we are admitting a particular patient who is high risk, and we are not counseling and communicating, and if something goes wrong, everything comes on the head of the organization. So the proper education system has to be improved. Now the technology comes, I think technology again comes and plays a major role. And yes, definitely, when we are planning up the new hospital, like for me, if I will build a new hospital with this Kamla hospital name to another center, yes, I have my mind frame set for the upcoming any kind of outbreaks or structural changes I will be making accordingly. So we are now mentally prepared for the structural changes. We are technologically improving ourselves. And yes, we are learning the skills also. As I told, being gynecologist, I became more a physician. So we are open to learn, and we should open to learn the technology. Being doctors in nursing homes or those who are doing in private sectors, we were not aware of how to use the online platform for counseling, how to use online platform for even consultations. Now these things we are also learning, updating our skills, updating ourselves to come back for the future and come with the new skills. And I think by this we can work as a good healthcare system in government as well as in private.
Right, right. Thank you, ma'am. So you raised a very valid point, about preparing for the future, and in terms of expanding, the kind of things that should be kept in mind. So I'll throw up another question on this. So how do you see the future of healthcare in probably tier 2 and 3 cities in the coming times, and what can be the ideal model, for a healthcare provider in terms of the opportunities? So Dr. Prasad, if I can begin with you again, in terms of the opportunities that lies ahead for tier 2, 3, and 3 cities for healthcare providers.
Well, India is a huge geographical expanse and with islands of excellence in terms of healthcare institutions. Well, all or almost all the good and large healthcare institutions are present in the larger metros and cities. Over 80% of the population of the country live away from these metros and cities. So one of the biggest challenges is how do we reach out to these people who are living outside the metros and cities? There are new hospitals which are coming up, and for a good reason. And I think the physical presence of a hospital in these areas, with most importantly, trained, skilled manpower. I think that's the most important part of it. It is easy to, if you have the money, it is easy to build a beautiful building with all the infrastructural requirements and with all the technological requirements, but you will not get the people to do it. Only yesterday I saw a report from the National Medical Council, which says that we have 13 lakh registered medical practitioners in allopathy across the country, which is less than one per 1 lakh, which is mind-boggling. So we don't have enough number of people. So I think one of the first things which we would need to bridge is the skill gap in healthcare, whether it's the doctors, whether it's the nurses, whether it's the technicians. Dr. Jyoti was just talking about the skills of operating a ventilator. Yes, a lot of people don't know because they were not taught about it. So it's not just the number of people that we need to increase, it's also the skill of the people that we need to improve to be able to match the requirements of the future. And I think moving into the future, in Tier 2 and Tier 3 cities, more number of physical hospitals will come up. But I think it will be technology which would be the easiest way to provide access to people living away from this physical hospitals. And it is a better way to provide, it's a cheaper way to provide access. But there is a bigger challenge. There are two Indias. One is a digital savvy India, the other one is a digital unsavvy India, if I can use that term. So unless this digital bridge is gapped, the benefits of medical technology would also not reach the people living in rural and semi-urban areas. So I think apart from creating physical infrastructure for this section of population living in these geographies, it is also important to bridge the digital gap to be able to offer solutions in terms of healthcare for people living outside the larger cities.
Right. Thank you, sir. So, Mr. Vinod, if you could, share your views on this, and if you, probably agree with what Dr. Prasad just mentioned here.
Yes, I completely agree with Dr. Prasad. If we look at the one area which perhaps it's safe to say has got maximum eyeballs in last 2 years is the digital transformation. Like every person is talking about the digital transformation, and of course it is here to stay because of all the valid reasons. Like if you look at the hospital approach, what has happened pre and post. Pre, it was more of a inward looking and record keeping, but now it is more of a looking outside in, and not only record keeping but utilizing the records. That's what everyone is talking about, and that's where the entire game is. We are talking about AI, we are talking about data mining. Of course, I'm going to talk on it today. Today what technology has done, technology has enabled the healthcare provider to have direct and more interaction and access with the consumers. So, and this is possible mainly because of all the technology advancement which we have. Right from, we are talking about teleconsultation, we are talking about artificial intelligence, we are talking about remote monitoring, internet of the things. All these things are actually helping, and then why it has come up, we need to understand. That's mainly because of the gaps which we have. As Hariprasad said that there's a huge gap in where the concentration of healthcare professionals are. The healthcare professionals are largely into tier 1 and metros, and if you look at our population exactly opposite ratio is in rural India. So how do we bridge this gap? And we require something which is a quick fix. So technology is an answer for that. Technology is definitely answer for that. It also will allow us to reduce the burden on the clinicians right now, because the tools, the technology which provide us can predict a lot of things, can analyze many things, and can be quick fix. Definitely we cannot ignore the solid infrastructure which need to be created, because if we look at the ratios which is given by WHO, oh god, we are nowhere closer to it when we talk about doctor to a patient ratio, nurse to the patient ratio, or for that matter bed to the patient ratio. And that will take time, and it should not be ignored, because that's something which is extremely important. Technology can be enabler, and which is very important, but we should not ignore this part. So a technology can also help us in terms of doing a quick analysis. There are a lot of lifestyle oriented diseases which are coming. A lot of research can be done by predicting for the trials for a medicine, so vaccinations. So technology is the answer to a great extent. What future we are seeing from healthcare. Even the move by the government of India, which is Ayushman Bharat digital health mission, is very nice move by government of India, because and certainly it will require a great amount of collaboration between all the stakeholders, right from healthcare provider to NGOs to policy makers to healthcare professional. And I'm sure the way how I was going through the session since yesterday also, there's a lot of synergy which is getting built up. So yes, everyone has realized that also reflect into the budget. When we talk about 2023 budget, the first cut, that clearly sees the way how budget has gone up from last year to this year into the technology space. Certainly that's one of the thirst area, uh, from when we look at the future of the healthcare, uh, the digital transformation.
Right. Thank you, sir. Dr. Chauhan, so how do you see this, concept shaping up?
So it's a bit challenging, and I believe one size doesn't fit all. So I think there will be various models which will coexist around the healthcare delivery space. And yesterday I was speaking to retired consumer forum judge in Surat, and what he shared was very scaring for me. That out of all the consumer cases filed, more than 70% cases were filed against the either insurance company or some hospital or some doctor in the consumer forum in last 1 year, and that count was very negligible pre-COVID, right? So there is some introspection which we all have to do, and there is an ongoing debate around the so-called futuristic healthcare aggregators model, which is which has become the kind of unicorn. So I think ethics will take the center stage around which the futuristic healthcare models will eventually be shaped up. Otherwise the people at large will not be able to appreciate the kind of efforts and the leadership that healthcare players and the doctors and the medical fraternity is taking up, right? So it is a very delicate time where we ourselves has to decide that okay, in which direction we want to go ahead. And I think if we remain transparent, we remain ethical, I think there is no need of the external regulators. Otherwise government is also in the talk to empower the IRDAI to give them the more the regulatory powers, which will ultimately come and regulate the healthcare bodies, right? So that is the the one concern or the one area where the future will depend a lot, right? So that is one thing. And the role of government is very clear, that they want to push the social insurance Ayushman Bharat in a very big scale. The government is also banking heavily on the the national digital health mission or the national digital health policy. They want to ensure that okay, the digital health and the digital mechanism has to the be the center pivotal point in and around the healthcare delivery space, right? As Dr. Hari said, that there are two Indias. One is tech savvy, and the another one is not so much tech savvy. And another challenging area is the people living at the the peripheries of the metro cities and the bigger cities, because we do have NRHM for the rural health programs, we do have NUHM for the urban health programs, but there are a lot of people and population which is living in between, right? Not rural, not the metro cities, but at the peripheries. And even the Surat Municipal Corporation, Ahmedabad Municipal Corporation, they are now devising a lot of town planning policies, which is focusing and covering those villages at the peripheries, then including in the the corporations. But basic amenities like roads, electricity, the good healthcare providers are not available in that segment. So that is going to be the uncatered mass, which will the big client pool, which will be available for the healthcare players to tap into, right? Because of the the cost of ownership is less, cost of establishing the hospital is less, but again there will be a challenge of providing the skilled manpower, medical as well as the administrative bandwidth. So that is going to be the challenge. So I think a lot needs to be done, and we all are hopeful, and we all are contributing in whatever way we can, right? So
Right. Thank you, Dr. Chauhan. Dr. Yadav, are you there? Yeah. So if I
Yes,
can
I'm
have
very
your
well
views.
there, and every time I'm getting it, the last, and everybody speaks about that. I think the whole thing. But here, I would say in future, the two or three things which I feel like, one is unity in the healthcare workers, like unity of doctors. It has to be in association with everyone, make it a good practice which can save us, save our skin. The thing is, see, in pandemic what we were facing, or without pandemic also, the nursing homes or the setups which are run by one specialists, the biggest challenge which because of the crowd, legal laws has to be, I think, they should be tailored in such a way they protect the healthcare workers. Because every now and then we are having the mob attacks, we are like destructions of the hospitals, attacks on the doctors. So by these actions of the society or the people, what we are into a mess, and what we think is, whenever we get a high risk patient, we are much bothered about that, taking the consents, doing the paperwork, or either sending the patient to the higher center without even touching or without even attempting to save the life. Because we are saving our skin first, because the scenario has changed and the people are like made that way. So what I am doing nowadays is, I am taking 5-10 minutes when a patient is visiting me in my OPD, and I take 5-10 minutes in order to educate the patient, in order to communicate about the healthcare problems and the healthcare workers, what they are facing actually. Like, we are not there to kill anyone, we are there to save their lives, and we try our level best in order to save. But we are not god, or we are not having everything which can be saved. Or even in the bigger hospital also, the mortality, morbidity, everything is there. But now what I have taken as an initiative is, I am devoting 5-10 minutes extra, despite of like busy or whatever I am, so that the crowd which we are catering on day to day basis in the OPD, they are the people where we can spend an extra time to educate them, so that they don't bounce back to us, they don't bounce back on the doctors or the healthcare workers. And yes, I would say there has to be a unity, there has to be a union of the IMA doctors, or I would say the associations in every city, so that they can work as a group, or they can save themselves. And one has to be there for another, like there has to be a ready help for healthcare workers. And by the government, I would say the laws and the legalities should be little lucrative and helpful for the healthcare professionals to work in a better way, and to work in a better, or I would say they should feel safe at least while we are handling the patients. Nowadays we don't feel safe actually, and
Right.
that
Very
has to be improved, that needs to be improved in order to save our skin. In
right, ma'am.
even
Right.
pandemic, I would say, in the pandemic, what we were doing, government didn't give any assurance or any insurance to the healthcare workers who were falling short of, like, who were trapped in the COVID. They were not given any extra healthcare assurance, or even a single bed. Even a doctor was fetching a bed for himself or the family. We were into that mess, still we were working. So the things has to be little more favorable for the healthcare workers in order to execute the show in a better way. That is what I want to add.
Right. Thank you so much, and very valid point. So we just have about time left, for having a quick final word, about the key take-home message that the healthcare providers would like to provide to our audience, and to of course the wider population. So Dr. Prasad, if I can begin with you again, what will be your key take-home message?
Change and innovation are the only thing which are constant. Everybody knows about it, everybody understands it, but everybody resists it. I think the first thing to do is to embrace change, to embrace innovation, and the best way to do it is in a partnership. I want to say this: professionals strive to make the right decisions. while the entrepreneurs strive to make decisions right. We need both the right decisions and the ability to make the decisions right. So you'll find that the best entrepreneurs in the world have the best professionals working for them. Healthcare of the future needs the great entrepreneurs and even greater professionals. This is the only way we can nurture change, foster innovation, and most importantly, make sure that whatever change and innovation is coming in is sustainable over a period of time.
Right. Thank you, sir. Dr. Yadav, your take-home message.
Thank you so much. So I would say first thing which Dr. Prasad very well said is the welcoming the change, learning the new things. Like the very small example I'll quote here. My daughter chose a subject which is policy making. I was so shocked and surprised what exactly it is gonna cover. Then she started explaining me, I'll be making policy for whatever you want, like either I go in healthcare or in the government sector. So that thing came in my mind. Yes, the future generation is coming up with all these new kind of innovations. Yes, we need to understand, we should welcome the change. And again, the thing is, we should have a good team to work on. As Dr. Prasad said it is partnership. So there has to be a teamwork and in a collaborative manner.
Right. Thank you so much, ma'am. Dr. Chauhan, if I can have your last word.
So change is inevitable, and I think we need people with the heart at the right place. And there are three things: the trust and teamwork, technology and transparency, which will be very, very much essential for us to be the future proof and future ready. Right. So this is the take-home message from my end.
Perfect. Thank you, Dr. Chauhan. And Mr. Vinod, the final word.
Yeah. I would simply put it in saying that healthcare need to be transparent, accessible, affordable to the people. The idea is that everyone should work in these areas, because if these areas are not met, then it is not a healthcare, because healthcare is a right of every individual. So these three areas, and it has to be feasible for the people who are providing. Just going from a role of provider to a sponsor doesn't solve the problems. There's a huge amount of investment which private hospitals do in terms of getting a facility ready and to maintain it. Providing a sponsorship support, and because then you are not able to have a right kind of practice, you are not able to deliver a right kind of healthcare. When we talk about the technology is here to stay, provided they give a better clinical outcome. They are giving a better personalized care. There's a better turnaround time. There's a real-time monitoring of the patient. So if all these areas are met by the technology provider, I'm saying it is here to stay, and they are going to enjoy the long stay in healthcare.
Wonderful. What a wonderfully insightful morning that we've had to the second day of our summit. And I would just like to inform the esteemed gathering about, two of our upcoming events, which we have, which is the 4th Diagnostic Leadership Summit on the 22nd and the 23rd of March this year, and the 2nd Pharma Leadership Summit on the 26th and the 27th of April. So we look forward to have your presence again with us. And I once again extend a very warm gratitude to all our esteemed panelists here for their time and presence. So please accept a small token of gratitude. Dr. K. Hari Prasad, thank you so much, sir. It was a wonderfully insightful, experience listening to your thoughts. Mr. Vinod Sawant, thank you so much, sir, for your presence here. It was wonderful, having you with us. Dr. Biren Chauhan, thank you for your time and your presence, and of course your, very well articulated insights. And Dr. Jyoti Yadav, Director, Kamla Hospital, thank you so much, ma'am. It was, very wonderful listening to your thoughts here. So I extend a very warm thank you to all of you again. Thank you so much for being at, the 3rd ELETS Healthcare Transformation Summit. Thank you so much.
Thank you so much to my co-panelists. It was good to have you all here. And thank you so much, Garima.
Thank you, everybody. All the best.
Thank you, sir. Thank you so much.
Thank you, everyone. Thank you, Garima. Thank you, everyone.